Hi, my name is Dr. Amit Agarwal. I'm joined by Dr. Alex Schlacterman and Dr. Faisal Kamal here at Thomas Jefferson University in Philadelphia. First of all, on behalf of my co-authors, I would like to thank GIE for giving us the opportunity to discuss our recent article entitled Cold Snare versus Cold Forceps Polypectomy for Endoscopic Resection of Diminutive Polyps, Meta-Analysis of Randomized Controlled Trials. As you all know, diminutive polyps are polyps that are less than or equal to 5 millimeters, commonly found during colonoscopy, and the practices for resection of these polyps vary amongst endoscopists. My first question is to Dr. Schlacterman. Why do you feel the need to do this study?
Well, diminutive polyps that are less than or equal to 5 millimeter colorectal polyps are commonly found during colonoscopy. And the practices for resection of these polyps vary among endoscopists. The U.S. Multi-Society Task Force, or the USMSTF, guidelines recommend cold snare for resection of diminutive polyps and recommend against the use of cold forceps for these polyps. Cold biopsy forceps are sometimes easier to use compared to snares, especially for diminutive polyps in the left side of the endoscopic field of view. They cannot be positioned appropriately to allow for use of snares. In recently published randomized controlled trial, one specific one, Wei et al., found that use of cold forceps polypectomy was non-inferior to cold snare polypectomy in resection of polyps less than or equal to 3 millimeters in size. And snare resection was significantly more time-consuming than resection by forceps. Therefore, we conducted this systematic review and meta-analysis to compare cold snare and forceps for resection of diminutive colorectal polyps.
Thank you for answering that, Dr. Schlacterman. Now for Dr. Kamal, a question for you. What are the findings of this study, and what does your study add to existing knowledge?
So for this meta-analysis, our primary outcome of interest was the rate of complete resection of all diminutive polyps. Our secondary outcomes were the rate of resection of polyps less than or equal to 3 millimeter in size, failure of tissue retrieval, and polypectomy time. We performed subgroup analysis based on the types of forceps used, such as standard capacity forceps and large capacity or jumbo biopsy forceps. We found that the rate of complete resection of all diminutive polyps was significantly higher in the cold snare compared to the cold forceps group. Subgroup analysis showed that there was no significant difference in rate of complete resection between groups when large capacity or jumbo biopsy forceps were used. We found no significant difference in rate of complete resection of polyps less than or equal to 3 millimeter in size between groups for all types of cold forceps. The rate of failure of tissue retrieval was significantly higher in the cold snare group compared to the cold forceps group. We found no significant difference in polypectomy time between groups.
Thank you, Dr. Kamal. And now for Dr. Schlacterman, what are the conclusions?
Well, our meta-analysis supports the use of large capacity or jumbo biopsy forceps for diminutive polyps, especially for polyps less than or equal to 3 millimeters in size. We cannot recommend changes in guidelines or clinical practice based on the findings of our meta-analysis due to its limitations. However, our findings could stimulate more research that can potentially affect polypectomy practices in the future. Future large multi-center randomized controlled trials with standardized and homogeneous polypectomy techniques and procedures would be required to make any firm conclusions.
Thank you, Dr. Schlacterman. So once again, we'd just like to thank GIE for giving us the opportunity to present our work. I hope you will find our article interesting and useful in your current practice. Thank you, everyone.
Thank you.
Thank you.